I woke up around 2:30 in the morning with chest pains, a burning sensation going up and down the center of my chest. It was Thanksgiving weekend, so we had indulged in Thanksgiving dinner, right? So I thought I ate too much and just had a bad case of acid indigestion. And then I started getting the cold sweats and dry heaving. That's when we knew it may have been something more than just acid indigestion, and decided at that time we needed to go to the emergency room. So I went to HCA Florida Southwood Emergency.
And it woke you up out of your sleep?
It did wake me up.
Okay.
When he came in, he was diaphoretic, he was sweating, he was complaining of chest pain, and he was clutching his chest, which are all very bad keywords that you tell anyone in the healthcare profession. And I knew that something was wrong when my charge nurse, Angie, came in, but she was worried, and when your charge nurse is worried, if there's one thing I've learned over the years, you trust your charge nurse.
When I came in that Saturday morning at 2:30 in the morning, by the time I got put into the room at the ER clinic, the symptoms were gone. And the blood tests and all came back somewhat elevated, but normal mostly.
He looked great. I'll be honest, ER doctors are great at seeing a patient and seeing whether they're sick or not sick. He did not look sick. He looked fantastic. He was cool, calm, collected, but something was still off. His story worried me, and I talked to him and his wife, and I said, "You never come to the hospital. I think you should stay at least one night in the hospital, see my cardiology colleagues, and get this fully figured out."
So they transferred me to HCA Florida Capital Hospital.
When I went in to do the procedure on Scott, what I found is that he had significant blockages in at least two of the major arteries around the heart. In his particular case, the blockage was very long. We felt, and I felt after some collaboration with some of my colleagues, that bypass is the best way to consider doing this.
So after the catheterization, it was determined he had a very tight blockage in the artery called the widowmaker. He was placed on a heparin drip, which is a blood thinner, and not allowed to leave the hospital because the risk of sudden death is very high when a person has that blockage.
At that time is when it really hit real. That's when it really like, holy moly, I got a major problem here.
We did his surgery. We used the internal mammary artery, which is under the breastbone. His recovery was very uneventful. He was in very good health prior to coming into the hospital, and that made his recovery much easier than someone who is in poor condition. Good to see you again.
Good to see you. Thank you.
You're looking real good.
Thank you, sir.
These doctors, if they could have just sent me home. They could have sent me to see a regular cardiologist, and this could have happened again. But the detail that these doctors and nurses and charge nurses do, and looking for answers and not just pushing you through the door and out the back door, was what saved my life. They stayed on top of it. Without that type of dedication to their service and to their patients, I probably wouldn't be here.